And I'll have you stand still because we're going to do hips next too. After you've done flexion and extension, you can also check for rotation. So you basically just turn your body to your left side and then turn your body to your right. And then you also want to check for lateral extension. So just bring your left shoulder kind of down to your left hip and lean into it a little bit. There you go. And then the same thing on the other side. And at that point, you're just checking for spine and everything like that to make sure everything looks symmetrical. After you've done the back and you've assessed all of the spine, you can move on to the hips. So for the hips, you're really looking at the location, make sure that it's symmetrical. You can check for the iliac crest. You want to check both sides, and also the spine in this point too. After you've assessed the symmetry, you can have your patient sit back down, and then I'm actually going to have you lay down for this one. Help them into the supine position, and after you've had them laying down, you can go ahead and move on with the rest of your hip assessment. So for range of motion, you can do flexion and extension. So for flexion, you would just have the patient bring their knee up, and extension, back down. You can also do this test standing and have them extend, kind of backwards. After you've done flexion and extension, you can go ahead and move on to internal and external rotation. So just by bringing your right leg up. So you're going to rotate your knee internally and then externally, and that's just checking for hip. You would check for hip discomfort there too. And then for abduction and adduction, so abduction, you're going to take your leg straight and kind of bring it towards me, but like leave it straight. Don't bend your knee. And then bring it this way. There you go. And then adduction, bring the leg back in. After you've assessed all of that, you can do what's called the Trendelenburg test. So I'll have you sit back up. And then just stand right in front of the bed. For the Trendelenburg test, you just have the patient close their eyes and go ahead and stand on one foot for me. And then repeat on the other side. Good. And you're just assessing for dizziness, any instability and things like that. You can sit back down. So after you've assessed their hips, you can move on to their lower extremities. So for lower extremities, you're just assessing their legs and knees. So you're going to go ahead and start with, after you've done your hip, you can move down to the knees. For knees, you're going to assess your femur, your tibial tuberosity, and your patella. So you'll kind of just assess where the femur would meet with your patella, and then your tibial tuberosity, which would be down low. Again, you're looking for nodes, you're looking for symmetry of your patellas, and any redness or anything like that. Once you've identified that, you can move on to range of motion. So you can do extension, which is just extending, and then flexion, which is bending back. And then after you've done that, you can do the flexion and extension with resistance. So just kind of apply some resistance against their foot and go ahead and extend and then flex backwards. And you would repeat that on the other side. After you do that, you can go ahead and assess with coordination for the knee. So you just take your right knee, your right heel, you want to run it up and down your left shin. And you can just make sure that they can do that and then repeat on the other side. You can also do the McMurray test, which is to check for any meniscus tears. And for this test, all you really do is kind of take the knee and passively rotate it inwards and outwards. And if the patient complains of any pain, then that could be indicative of a torn meniscus. So after you've done knees, you can move down straight to the ankles and the feet. So starting with the ankles, you want to identify the medial and lateral malleolus. You can identify the Achilles tendon and your tarsals and metatarsals in the foot. While you're assessing this, you just want to assess again for pain, any tenderness, nodules, anything like that. Once you've identified all of those, you can then move on to flexion and extension. So you're going to kind of point your toes and then flex your toes, good. And then internal rotation, you're kind of just rolling your foot inward, and then external rotation is that way. After you've checked rotation, then you can go ahead and use do dorsiflexion and plantar flexion, which we basically just did. And now we can move on to assessing reflexes. So for the reflexes, you'll want to assess your Achilles reflex, your plantar reflex, and then a Babinski reflex. So for the patella reflex, which we also want to check, you'll have the patient sit on the edge of the table with their legs kind of hanging down. You want to identify your patella and identify that patella tendon there. Once you have, you just take your reflex indicator and go ahead and tap their tendon, and just make sure that they have a reflex there. After the patella one, you want to move down to your Achilles tendon, and you can kind of support the patient's foot. You identify your Achilles tendon, and you go ahead and tap there, and their heel should move up and down. And then after you've assessed that, you can also assess for a Babinski reflex by holding their foot out and kind of taking a dull edge and kind of scraping it up the bottom of their foot. Their foot should kind of flex downward versus flailing backwards. I'm sorry. And it worked just fine. So you can also assess for a Thompson test. And for this, it's just assessing for Achilles tendon rupture. Basically, whenever a patient is laying prone, you can squeeze their calf, and if their foot does not move to a plantar flexion, then that means that there's some type of Achilles tendon tear there. And I believe that that covers everything for our neurological and musculoskeletal examination.